Good morning. This is your Dr. Vinay, surgical gastroenterologist. We have recently come across news items where 4 women have died after tubectomy operations, birth control operations. And for this, the doctors have been blamed. But let me tell you, one cannot blame the doctors completely, because it is the government which gives, it's the DME, the DMNHO, these are the people who give targets to the doctors and the nursing staff, saying so many cases have to be done in a day. I still remember in my postgraduate, undergraduate days, we were asked to go and do cataract eye operations. It's such a dangerous thing to go and do in the villages where a person can go blind, and the sterilization techniques were absolutely horrible. When one does a laparoscopic sterilization, the instruments have to be sterilized for a minimum of 45 minutes before taking up the next surgery. So if the government targets have to be met, there should be at least 3 or 4 laparoscopic equipments. But the government gives only one set of laparoscopic equipment and says meet this many targets. And that 45 minutes sterilization is compromised, and that's why all these infections come up. But if that is one area, the other thing I would like to say is it's quite a problematic operation for ladies. 1, it has to be done under general anesthesia. 2, the abdomen is cut, and then the laparoscope is introduced inside. We go through the intestines. Setting aside the intestine, we have to identify the tubes. If there is gas filled in the intestines, the operation becomes that much more difficult. The tubes have to be identified and then cut and clipped. Whereas in a male, the vasectomy operation, birth control operation, the vas difference, what we call, is directly under the skin. No anesthesia is necessary. The needle which is introduced is so thin that even an injection is a little more painful than that needle. The vas is very easily picked, cut and tied off. If in a woman it takes half an hour, in a male it doesn't take more than half a minute. It's such a simple operation. No anesthesia required, no intravenous fluids required, no painkillers required, no antibiotics required during the surgery. Post-operatively, some people give antibiotics, a lot of people don't give antibiotics also. So in a female, there is a risk of life. In a male, there is not even a risk of pain happening to the patient. So my appeal to everyone is, please, let us not put women through all that torture. All this talk of women, males becoming weak, nothing of that sort happens. There is no proven weakness in males, either physically or sexually, recorded anywhere in the world. The operation is so simple that when I decided to undergo this birth control vasectomy operation, I requested one of my friends to come and do early in the morning. After he did that, in that same operation theater, I stood for 8 to 10 hours and did 3 or 4 major surgeries that day. I'm just telling you, it is as simple as that. So please don't let the women go through something which is risky for them. I would advise the males for whom it is a very, very simple operation to go through the vasectomy operation. Thank you so much.